A surge in cases means a surge in hospitalizations, and now the state is facing a shortage of doctors and nurses to help take care of all of those patients. KPIX5's Wilson Walker reports on how hospitals are trying to survive the surge. Wilson?
We said this would be the first crunch, not beds. People is what you are going to run out of. And today we heard that warning in particularly sharp terms. First, from a kind of remarkable consortium of the state's 3 largest healthcare providers and from California nurses.
Listen, hospitals were a place, that were understaffed and under pressure prior to this pandemic. It's the nature of the industry.
For nurse Sarah Egan, the winter surge is just the crescendo of an already exhausting year. Across the state, hospitals have had to stretch staff to the limit, and the staffing agencies that normally provide backup help for California are now busy helping the rest of the country.
And so people are burnt out, and we're afraid. We've been working short-staffed for months now.
But as the hospital bed count continues to dwindle, we simply will not be able to keep up if the COVID surge continues to increase.
Today, leadership from Kaiser, Sutter, and Dignity Health teamed up for an emergency briefing, saying they felt a collective responsibility to warn everyone about the seriousness of the situation. 16 of their 36 hospitals are now at ICU capacity. While they can find more beds, it is people they are running out of.
Moreover, it means that our nurses, our physicians, who are already stretched and tired, must extend themselves even more to care for more and more patients.
And that crunch is now generating some pushback, specifically from nurses upset with Governor Gavin Newsom's move to change the state's patient-to-nurse staffing ratio.
And they've had a year now, right, to plan for how we were going to address this, because public health officials predicted how bad it was going to be at this time of the year. And their only answer now is to dump the excess onto nurses illegally. And they're trying to get permission to do that. And, I can't express to you enough how frightening it is for me.
So, Wilson, is there anything the state can do to get more nurses and doctors in to help?
Well, you just heard the governor is tinkering with the law that required a 3-to-1 nurse-to-patient ratio. That's the only state in the country that has that law. He's tinkering with that. The staffing agencies that would bring in, traveling nurses as they're described, we mentioned those are short, or they've been gobbled up by Southern California, which preceded us in this acute problem here. So where do you go? Well, overseas, it's Australia and Taiwan the state is looking at to bring in some medical professionals if this crest of cases continues into early next year. They think the problem will only get worse going into January.
All right. Thank you so much, Wilson. The state